If there is one health condition in babies that is both frustrating, overwhelming, and weirdly controversial, it's colic. The controversy comes in multiple forms, with many conventional pediatricians still mistakenly stating things like, some babies just get colic, or don't worry about it, your baby will just grow out of it. But also at the same time, there is all sorts of debate as to how babies get colic in the first place and what is the real root cause. In this video, we'll break down the real science behind colic, keep it super simple, and get right into some safe, natural ways to help ease your little one's constant crying and discomfort. This video is for parents of babies struggling with colic, desperately looking for answers and relief for the constant crying and sleepless nights. But also parents who know that it's not normal that their babies are so uncomfortable, they're constantly crying, and they're always physically uncomfortable, and they're constantly arching their back and cranking their neck around just to find some type of relief. In this video, we're also revealing how optimizing vagus nerve and overall neurological function could resolve many of your child's health struggles. Learn gentle ways to stimulate this essential part of the nervous system, plus specialized chiropractic care to detect and address vagus nerve dysfunction without any drugs or surgery. We have this really awesome baby under care. His name is Jackson. Jackson struggles really badly with reflux, gas pains, sleeping at night. Jackson's mom said it was very difficult for us to try to navigate being first-time parents and having Jackson struggling with these issues. She said it was so hard to see Jackson so upset and unhappy because he was always so uncomfortable. So Jackson's parents took action. They took Jackson to their amazing holistic pediatrician, where they are always looking to find the root cause of a child's struggle and not just put a Band-Aid on the symptoms. And for Jackson, they knew that stress of a very fast labor and delivery was part of that root cause. So they were referred to us, and mom said, we are so thankful to have a pediatrician who right away recommended chiropractic once we brought up our concerns to her. And here's how it went. So Jackson's mom said that Jackson started getting adjusted when he was about 9 weeks old. And within the first couple of weeks, we definitely started seeing changes. We first noticed that he was no longer having constant gas pains and didn't seem as uncomfortable anymore. She also said that within the first month, Jackson's colic seemed to disappear. And we started to see Jackson's happy, silly personality coming through. Now, with continued care, Jackson's mom said that he was a completely different baby than he was when he first started. His colic and his stomach pains were completely gone, and his reflux was better than ever. And he was even sleeping through the night. Wow, that's amazing. Now, as a toddler, Jackson's mom said he's truly the happiest and always smiling and laughing. We cannot be more thankful to have found Harmony in their office. They taught us so much about chiropractic care and the benefits it could provide to Jackson. Thank you for giving us our happy boy back. Now, we could not be happier that Jackson is thriving, happy, and healthy. All natural and all drug-free, and with the best parents he could probably ask for. The vast majority of colic patients we see here at Harmony have at least one of the following hidden in plain sight stressors in the case history. Number one, high stress or high risk pregnancy. Number two is birth interventions like forceps, vacuum extraction, induction, epidural, or C-section that can physically injure and alter the function of the nerves, muscles of the upper neck that then control things like sleeping, latching, breastfeeding, swallowing, digestion, and gross motor development like turning the head, tummy time, and so forth. These two very common initial stressors cause baby's nervous system to become highly sensitive and stuck in what we call sympathetic fight or flight mode. Sympathetic dominance interferes with sleep, shuts down our digestion, and then leaves physically uncomfortable once that subluxation in sympathetic dominance sets in for the infant. They struggle with basic health functions like sleeping, eating, pooping, and just moving. When their little one is constantly crying and uncomfortable, parents innately know that something within their little bodies is not working well. And that includes both internal muscles that control digestion and the external muscles of the neck and spine. This is why infants struggle more after eating and are more constantly arching their neck and back. Now, in today's world, by the time we get to assess and examine a colicky infant, many times they're amazing parents who have already removed dairy and other common foods that have a higher risk of allergies and intolerances. And many families today have also already had their children's tongue or oral ties surgically revised and clipped. While tongue and oral ties absolutely cause an infant trouble with latching, nursing, it can be really uncomfortable, it's important to continue to look deeper at what the real root cause of even these tongue ties are. While we may sound like a broken record, which is we want to be, it's important to know that if a kiddo's nervous system is stuck in that sympathetic fight or flight mode, it will leave all the muscles, all the ligaments of the body extra tight, extra wound up, and tense. So even if the tongue and oral ties are surgically revised, the tension will remain on the nervous system and throughout other important parts of the body. While most everyone will look at the stomach or digestive system for the real root cause of the colic, often is found even deeper within the nervous system and its control and coordination of digestive motility, absorption, and elimination. When tension and subluxations build up along the neurospinal system, a colicky baby will often arch their back and crane their neck, trying to release or dissipate that tension themselves. When this occurs, it is an absolute sure sign that the real root cause of their discomfort is neurospinal discomfort and tension, not merely digestive dysfunction. Here at Harmony, our compassionate doctors are specifically trained to help identify the neurological factors behind colic and gently restore your baby's nervous system balance and comfort. We use a combination of thorough assessments and advanced technology called neurological insight scans to detect and measure the presence of subluxation and neurological dysfunction, or sympathetic dominance. If you're ready to find real answers and drug-free solutions for your baby's colic, click the link below or in our bio to visit our website and schedule your initial consultation. Let us help you and your little one find the peace, comfort, and restful sleep you both desperately need. Don't spend another exhausting night wondering if there's hope. DM us if you have any questions. Our team is ready to help.